Welcome to the Beat Pain Podcast, where we learn what actually works for pain relief, staying healthy, and navigating the medical world. I'm your host, Brandon Cope. Today's guest has experienced several chronic illnesses in her life. She shares her sufferings and what she has learned and how you can be smart about addressing your medical issues with your doctors. She is a doctor herself and knows both sides of treating pain and being in pain. If you want to know more about how she can help you with your health, then find her website in the show notes. Please enjoy my conversation with Amy Stenehjem. Amy, I'm so glad to have you on the podcast today. You have been through many different medical conditions and suffered through a lot of trouble with your health. Can you give us a quick snapshot list of all your medical conditions that you've been through?
You bet, Brandon. First of all, thanks for having me. I'm very honored to be a part of your podcast. I'm really excited to share my story and hopefully spread some awareness. I started feeling ill in fifth grade with some intermittent episodes of sore throats, joint pain, fatigue. When I was in high school, I was diagnosed with something called premature ovarian failure, which essentially is I went through menopause at that time. I attended medical school, and in my residency, so that's the training after medical school, I was diagnosed with undifferentiated connective tissue disease, which is an autoimmune related condition. Later in 2011, I was diagnosed with postural orthostatic tachycardia syndrome, and also eventually a periodic fever syndrome, which is an autoimmune type or autoinflammatory type condition. Also, another autoimmune condition I was diagnosed with later was Hashimoto's. And then in 2015, I was diagnosed with Lyme disease, reactivated Epstein-Barr, and in 2017, something called mast cell activation syndrome, and then later also mold toxicity.
Yeah, that's a lot of stuff that you've gone through. What do you feel like? I mean, having gone through so many different conditions like that, do you feel like there was one that was kind of like the main condition you had, or were they all kind of equally troublesome in your life?
Yeah, it's hard to know for sure, but looking back, I feel that probably there is something off with my body's ability um, uh, to detox, essentially, to eliminate chemicals and toxins that are normally in the air and what we eat and kind of all around us. And my body just doesn't do that. And there actually are some genetic conditions that aren't able to do that well. And I think that probably I was born with that, and then probably was exposed in grade school to some type of mold. In our home, I was in a basement bedroom, and we had some remodeling done, and I think that contributed to that. And then I have a strong, very, very strong history of autoimmune disease, so a very strong risk for developing autoimmune. And autoimmune disease means my body, the immune system, instead of fighting infections, it fights itself. So it gets overstimulated, overactivated, and it can damage organs and joints and such. So then that, I think, triggered then the multiple autoimmune diseases. And I also forgot to mention Hashimoto's, which is in that list. That was is a thyroid autoimmune disease. That's also part of that list. So
Okay,
I think that happened. And then I think the weak immune system allowed my body, which had been exposed to Epstein-Barr virus, which most of us have been exposed to, and our bodies fight it, and it goes dormant in our system, which means it goes to sleep and it never causes problems. I think when my immune system was so overactive fighting the body, it allowed it to not fight and protect itself. So Lyme infection, which I think I probably had for years, and my body was just able to fight it just fine. The Lyme, the Epstein-Barr kicked in, and then it just kind of was a cycle. So probably starts with some type of a genetic or early onset when I was a child of an inability to process and detox my body, then developing an autoimmune response, and then kind of led into my body not able to fight infections and therefore. So yeah, so kind of a process. That's my theory.
Right.
you know, I am a physician and I'm mainstream trained, and mainstream doctors don't believe in some of these conditions and may not even believe in this theory of mine. Um, my integrative doctors do believe in this process, and that's where I've working with them and doing my own research, I've been able to figure out that's probably what's going on. So
Yeah.
it took me a
Yeah.
while though to figure
Well,
that out.
so that's got to be super frustrating then on your end, having to go through these conditions, you not understanding them, people around you not understanding them. I mean, how do you deal with all that confusion, that frustration? Like, what a difficult process for you on your part, having to figure all of that out. That's so, is that like normal for a lot of people with those conditions to have a lot of struggle in figuring that out? Or is that kind of just you particularly had a lot of struggle with that?
No, it's super common. In fact, I was lucky that I had some at least basic understanding of the body, and I was able to look up my symptoms and do research. And my husband was really helpful with researching as well, because there was a period of time, I was because of I got the sickest in 2011, and I spent 7 years so sick that I wasn't able to leave the house except
Wow.
for rare instances, and if I did, it would really cause me to be much sicker for an extended period of time. And during that time period, there were 3 years where I was so sick I was mostly bedbound.
Wow.
Um, so it, it was very, very frustrating, but it was one of those situations where now that I'm feeling better and I figured myself out, I look back and I go, and I'm not cured. I still have the autoimmune diseases, and I still
Hmm.
have, my good days are probably not, they're probably not other people's good days. They're other people's maybe not so good days, but,
Hmm.
um, and I deal with feeling ill often, but now I can manage my symptoms much better and I understand it. So my quality of life and my hope and all of these things are so much different now. But, um, once I got to that point where I was feeling better and could look back and analyze and kind of look at what I went through and such, I realized that, there was a calling for me. There was a place for me that I needed to go, and I needed to help
Mm.
other people,
Yeah,
to
absolutely.
go through that process. So no, it is something that is not easy for anyone. It's very frustrating. Um, it it can be, at some points even, making people very angry, very depressed, very anxious. There can even be experiences where there can even be traumatic experiences emotionally, uh, of people going into their doctors and being dismissed,
Hmm.
which can be very traumatic. And so there's so many elements that go through. And then there's the grief of, you know, my life that I lost, or I feel that I lost. And how do I process that grief? The roles in your family relationships change some because you are sick. So that's a stressor. There's financial stressors.
Hmm.
There's things that happen that you have to problem solve and work through. Um, and there's always hope though. And so I want to make sure that I don't talk and make this sound so negative that people listen and go, oh my goodness, there's no hope. There is hope. I totally believe that
Yeah,
there is hope for everyone.
absolutely.
But yeah, it's not easy at all. No, not at all. It's a very difficult process, and I don't wish it on anyone. Yeah.
Yeah, absolutely. Yeah, there is totally hope. There is so much hope.
Yes.
We're here to talk about that hope. You're totally
Yay.
right. Let's go back to the doctor's office here, because you were talking about how you would walk into a doctor's office and then they would dismiss you. I mean, what was an experience you had where maybe you did that with the doctor? I mean, what is that like? You go, do they say it's all in your head? Your pain's not real? I mean, what is it that they're saying to you? How are they dismissing you? And what do you do with that afterwards?
Yeah, good question. So I was really lucky because I knew, there's certain ways to, this is, and I'm actually this is part of what I want to teach people, but there are certain ways to present your history, which means in real people terms, how do you explain your symptoms, and how do you act during the appointment to be taken more seriously? And I knew all of those things. I knew what not to say and what not to do. And so and I think also being a doctor, um, the doctors I saw, were not dismissive for me. So I was lucky I didn't have that. However, I did have, uh, uh, doctors in certain specialties who did not believe the conditions that I had. And one particular doctor who got very angry with me that I wanted to go through treatment for Lyme disease. And that was actually traumatic for me because I felt like I had to advocate for myself, and there was an argument, not physical, but an argument. And it was just, it was traumatic, but in the work I do now, and also just being on support groups and on Facebook and all of the different things, I hear stories. And so for people, the average person that goes in probably faces more than not someone who has illness that's hard to pinpoint. So people that doctors are used to seeing a patient with a classic set of symptoms and exam findings, and they do a test and the test comes back abnormal,
right?
And they give them a diagnosis and everything's good to go and there's a treatment plan ready. The people that they see that have maybe lots of different symptoms, complex symptoms involving multiple different parts of the body, that gets confusing for doctors. And they're also taught that, oh, that's maybe a red flag for someone where it's in their head. And so people, I lost my train of thought there, but
well, just how to give your story, because if you're giving confusing history to doctors and you're making them more confused, then they don't know what to do with you, and then they dismiss you, or you get a lot of mixed results because they don't know what kind of ways to treat you, and everybody just gets frustrated.
Right. And the doctor gets overwhelmed and they don't have time. Unfortunately, in our systems, the healthcare system that we have now, there's so limited time that they're given, big time, limited time. And so they're seeing patients, and it's not an excuse for mistreating patients or being dismissive. And that's something I want to work on with physicians and bring that awareness. But what happens is they don't understand. They do a test that's not abnormal. So they think, oh, well, then it must be stress. It must be anxiety. It must be depression. And the only tool they know of that they understand is to order counseling. Or antidepressants. Okay. So that's what happens is many people, probably more than not, get diagnosed with, I don't know, I can't find anything going on, could it be stress? Or even more forward, the doctor will say, I really think this is stress, you need to address it, or I think this is anxiety, and even worse, even in some cases it'll be even more aggressive. The doctor will say, you're depressed, get over it, you're, or move on with your life, or buck up, start, you need to work, excuse me, or you need to be more active, stuff like that. So there's definitely a range of responses from doctors, but it's not uncommon for someone with illness where the illness has multiple symptoms. It's complex. They're not a lot of really abnormal lab findings or test findings. It's not unusual in those situations for people to not get answers when they go to the doctor, and to feel dismissed and that they weren't listened to. Yep.
Yeah, that can be really tough. Now, you were saying that it's kind of different for you, or that you were kind of lucky because you're a doctor and maybe that gives you a different experience. And I'm curious why you decided to become a doctor. I mean, what inspired you to want to become a doctor? And then what is it like for you now being a doctor?
Yeah, good question. So my mom, when I was very young, 3 or 4, was diagnosed with lupus and Sjogren's. Both of them are autoimmune diseases, and she was very, very sick. She's doing better now, but she's very, very sick for about 10 years. And so some of my earliest memories are going to doctor appointments with her and my dad. And some visits, we would leave the appointment and my dad and mom would be very excited, very positive, feeling like they had a plan. Other times they would leave and my mom would be crying and my dad would be upset. And wow. I could just tell that the way the doctor handled the appointment made a huge difference, probably all of the difference in their attitudes. Because even finding out negative news, frustrating test results, if there was a doctor who was listening and understanding and had a plan and gave hope, my parents left feeling positive. And that also affected her health, right? So if you don't have hope, no doubt that affects, you know, affects the body physiologically. And I believe that can make you sicker, but that's not the cause of the sickness. And so when I was in grade school is when I decided I wanted to be a doctor, and I wanted to be one of those good doctors that my parents, uh, I wanted to provide that great experience for patients and help them. So that's how I wanted to do that. And it was about fifth grade was when I made that decision.
Okay.
And so, you know, I practiced until I got really sick in 2011. Then I had to leave my practice. And during the time I was homebound, I did start a website with some articles to try to help provide education. At the time, I was still, you know, pretty sick, so weren't a lot of articles, and there still aren't a lot of articles, because once I started feeling better, then I transitioned quickly to this business, which I call a health consultant. So it's a little different now for me, because I'm not acting as a actual physician, right? So I'm not providing diagnosis or treatment. So I'm calling myself a health consultant, which is a term that I coined because essentially it's a combination of a patient advocate, a healthcare navigator, you know, helping people navigate through the healthcare system.
Right.
I'm a coach in a way, a health coach. I'm an educator. Um, and I also do research for people. So medical research. So if someone has symptoms that are unusual, I go beyond my specialty, my specialty is physical medicine and rehab. Um, real quick, physical medicine rehab docs, they specialize in treatment of those with bone, joint, muscle, or nerve disorders. So beyond that, where I don't have expertise, I do research, or if someone has a set of symptoms that I just can't figure out, I spend a lot of time researching. So the health consultant kind of covers all of those. And so my life is different than it is as a physician. So it's a little hard to answer your second question about what is it like to be a doctor now. Because it's different. You know, I work from home. I have more flexibility. I actually really, really enjoy it. Honestly, more than being a doctor, because of the time restrictions and the paperwork and the insurance restrictions. And there were so many barriers to providing the care that I wanted. In fact, when I was practicing, I always worked much longer than what I got paid for, because I wanted to provide that care which meant, you know, if I was under salary and my day ended at 5, I would work till 9. I would work
Wow.
on the weekends. I would work on my vacations. I would come in an hour too early and review every single one of my patients' charts to see what had happened since I last saw them. So, I mean, I was super, but it doesn't, for someone now who's gone through illness, that wouldn't work now, you know, for me. I wouldn't be able to physically keep that up. So, but I really like what I'm doing. So,
Yeah.
yeah, so that's what it's like. I enjoy it. I'm happy. I'm at a better place. And, yeah.
That's good. I mean, you're really filling in the gaps of what should be occurring in a lot of doctors' offices. You know, you're giving people that hope, which can be so vital for people when they're just, you know, they've been suffering with something their whole life. They're like kind of hanging on to a thread. I need to know that I can have a plan. I can get through this some way. Things can somehow improve.
Yep.
And they get that like 5 minute office time with the doctor, and every little word coming out of the doctor's mouth is like, you know, you're just hanging on it. And
Yep.
you know, like
Yep.
you were saying, like when your mom and dad would come out of the office, and it's like they might be super happy or they might be crying, you know. I mean, it's like it can totally change everything going on in your life depending on that little conversation. And
Yes.
there's so many gaps that need to be filled in. Explanation of like, what is this condition, and
Yep.
what are other things that we could be trying, or, you know, how can you navigate insurance or bills, or, you know, how you're supposed to interact with your doctor to get the best information from that limited time, and just so many different
Yes.
questions. And it's like
Yep.
you are filling in all those gaps, which is so important. And so many people need that. It's really vital. And it's so important that you are doing that because you've had all these experiences. You've navigated all of that stuff yourself, and you like, you know, the suffering, you know, like
Yeah.
you've
Yeah.
been there and done that. And so you can
Yep.
totally understand like how people need the hope and the state of hopelessness and just all the struggles that people go through. Yeah, it's so
Yep.
important.
Yep. Yep. Yeah. Yeah. I really am. lucky to be doing what I'm doing. Really, I'm very happy.
Yeah, absolutely.
Very blessed. Yep.
Yeah. I want to ask you a question just about chronic illness in general. I mean, you've had a lot of chronic illnesses, and those, I assume that those have caused you like pain at certain point. And so, for you dealing with people who've had chronic illness and you've had chronic illness, what's kind of the difference between like chronic illness and chronic pain? And is that sort of the same thing, or are those different things? I mean, what are sort of the different types of people that you would be working with and helping?
Yeah, good question. So first of all, just going back to my specialty. So I saw a lot of people with pain related. So when I was practicing, um, one of the main things I saw were neck and back, chronic neck and back problems, or other joint problems, or sports injuries, things like that. I myself have quite a bit of joint pain intermittently when I do have the autoimmune flares, but I haven't experienced what I guess the pain has not been the primary symptom for me. But I do understand to some extent what it's like to have chronic pain. And so when we talk about like definitions, so first of all, the medical definition of anything chronic is anything lasting 3 months or longer. And so when we talk about chronic pain and chronic pain is a form of chronic illness. So there are many forms of chronic illness. Chronic illness essentially means an illness lasting 3 months or longer. When we use it, I think out in the public now, we're talking more about people that have had something for more than 3 months, longer. But it doesn't mean that it's a death sentence. It doesn't mean it's terminal. It doesn't mean it's necessarily going to be a lifelong thing. And there's people with chronic illness that have the variety or in their severity and how severe their symptoms are. So, and so some people will be able to live what to others appear to be a regular average life, working and such. It doesn't mean that they don't go through struggles though, and that simple things are not hard. And then there are others who are very sick, like I was, who are bedbound from illness. And so chronic pain fits into that, where the predominant symptom in chronic pain is pain, but they can have other symptoms. So so a chronic pain is a chronic illness. Neither should be dismissed. And unfortunately in our society right now, with our response to what's going on with opioids, we've overcorrected the process, and that's a whole nother conversation, but we've overcorrected our approach to the extreme, where people with chronic pain are not getting, in my opinion, appropriate care. So there's, a big thing there, but essentially chronic illness and chronic pain are together in a group. And then the other term that I think is really important to know is something called invisible chronic illness. So I briefly spoke about that a second ago, but so invisible illness are those people where they don't have any signs of illness when you look at them. So you could look at someone and think they are perfectly fine. And the trouble or the difficulty, and there's it's very, very difficult. It's not just a minor difficulty, it's a huge difficulty, is that because the illness is not visible, there is increased problems with people not understanding the illness, which leads to less support. And so chronic illness could include, someone with pain, invisible illness, someone with pain, autoimmune, Lyme. I mean, there's so many conditions that are considered invisible illnesses where people don't see a problem, so they don't understand that you have an issue, and there's a huge lack of understanding for those with invisible illness.
Right. And you said something that doesn't have any signs. What's the difference between like a sign and a symptom? Because, a lot of times doctors, what are your signs or symptoms, or what are we trying to figure out? And it's like, what does that even mean? So something without signs, that's an invisible illness. What is a sign versus a symptom?
Oh yeah, good question. So, so signs are more of a medical term, and that's what the doctor sees when examining the patient. A symptom is what the patient feels. So a sign can also, it doesn't have to just mean, I use it in the, in the context of what people see, not just what doctors see. So they don't see signs or I don't know what another word, maybe evidence, or so instead of seeing someone with like a cast on or an obvious, limp or difference in how the body looks or obvious sign that there's illness, invisible means there aren't those signs. And so symptoms are what the patient feels, signs in medical terms is what the doctor observes and sees.
Okay.
Yeah.
Right. Okay. And, that can be tricky because, and especially if the doctor has never had something like that before. I mean, if the
Yep.
doctor has never experienced that themselves, then from their perspective, it's like, well, I don't see anything, so there must not be anything there, right? There's nothing like tangible that I can interact with. So, there can't be. And so that's the term invisible that you're talking about. And I'm curious, in the world of chronic issues here, chronic illness, how many do you feel like the majority of chronic illnesses are in that invisible category?
Yeah, I do.
Okay.
Yeah.
Wow. Wow. Is there one that is like the most common, or are they all pretty common?
Oh man, I'm not even sure, to be honest with you. I mean, chronic pain, back pain, and neck pain are probably the most common, um, neck or back pain and or neck pain.
Okay.
But yeah, I don't know, to be honest with you.
Yeah.
But yeah, I'd say invisible is going to be the most common group
Yeah.
overall. Yeah.
Well, it makes it hard to study too, because if it is invisible, then it's like even the person having it might not know exactly what they have. They just know they have a weird symptom. And so it makes it hard to
Yeah.
track and study and,
Yep.
measure all of these. We know that this amount of people have this problem. Well, it's hard to figure that out if it's invisible,
Right. Yeah, that's a super good question. So 2 points from that. So one would be, one thing that I think as people we're just not really good about is understanding and listening to our bodies and like hearing what our bodies are telling us, and then being able to analyze that. And that's something I do work with my clients to try to help them do. But it's hard when you don't really, you just know you feel crappy. You feel like you have the flu, or you just feel crappy. And
Yeah.
I'd like to use a different word, but I'm not gonna. But you feel just really, really crappy.
Right.
And so so that's difficult. But then when we go into the research, where you kind of mentioned studies and measurements, so doctors are really taught what's called evidence-based medicine. And so they're taught that unless there's evidence in a research study, and it has to be a certain type of study, which means the study needs to be, now we're getting into terms, but it needs to be double-blinded, which means the person receiving the treatment or not receiving it, and the person providing it, so the researcher, cannot know who's getting it. And then there has to be a control, which means something where they're not getting the treatments, the group. And then you have to measure, and this is getting real, maybe too much info, but tell me if it is.
No, please
Then
do. Please talk about it.
and then you have to measure some type of a measurement, right? And so when we're talking about maybe someone with diabetes, now diabetes would technically be considered invisible, other than once the disease has progressed and there's visible signs, and then also the test results, of course, will show up, which makes it a invisible illness that doctors get, though, and they understand it, and they usually appropriately treat that. But for example, if they're doing research on diabetes, they can monitor blood tests, and that's something that's measurable. But it's hard when people have illnesses that don't have good blood tests. And I'll say this, though, there are researchers out there who are looking for tests, that are looking for measurements that can be then used. And once we have those, then we can start doing more testing on treatment options. And once we have treatment that is evidence-based, shows improvement, we'll have more doctors being willing to look at things. But that's why one reason why we don't have mainstream doctors willing to look at integrative options, because there aren't many studies, and the studies aren't there because we don't have ways of really doing the kind of studies that doctors want, even though these treatments can be very helpful. And unfortunately, it'd be nice if it was just enough that the patient said, I'm better, I feel better, my quality of life. And some studies will do that, but we're taught as doctors, we really like those, we like data, and
Yeah.
unfortunately, so we're really stuck on that. Yeah. So that's kind of going into a whole different topic here about research and lack of, but the good news is we are finding information. So with patients with fibromyalgia, we're finding blood levels of certain things that are higher in those with fibromyalgia. So we're going to be, the goal is we're going to be able to have things that we can look at to help with diagnosis and monitoring treatment.
Right. Yeah. I mean, you're talking about the process of making studies. I mean, that's the process of trying to take these illnesses from the category of invisible to being visible, right? To make them seen.
Right.
Like if people
Yeah.
can do tests
Yeah.
and they've got that
Yes.
data, then it's like now people can see it. And I mean, it's, some people only have that lens in their eyes that they can only see things with data,
Yep.
and maybe that's just the way they were trained. Maybe that's just the way that medical school has kind of like produced our medical world, that it's like, if there's no data, we don't see it, it doesn't exist, and maybe that's just the reality. But if we can bring more visibility, if we can reveal and pull back that curtain of mystery around some of these conditions, then that's really just going to help everybody in the end. So those
Yes.
studies are super important. Yeah.
Yep. Yep. I agree. Yep.
Yeah. I want to talk
Definitely.
about something for your story with your chronic illness. You just something really specific that you talked about was mold in your house.
Yeah.
And I'm kind of thinking about this because I was literally talking to a friend of mine yesterday about them potentially moving out of their house because they said that they had mold and they feel like they've been ill for several months and they wanted to move out. And I'm just thinking about, for you, like, how impactful was that for you, that you transitioned house and you were like, oh, there's mold and, this is affecting me. I mean, how powerful is mold, which again is something that, like, you really, it might be hard to figure out that you have mold in your house. How powerful was that for you to get away from that mold and make a change for you?
Yeah. It was huge for me. That to me, I think if I would have known what I know about my body now years ago, I would have prevented where I ended up. But the things that have helped me the most in getting better and feeling more that I can manage my symptoms are avoiding mold as best as I can, toxic mold, and eating a really clean diet, air cleaners in the house, clean water, and then doing things that help me detox. So that's kind of the group. But so when we talk about mold, mold toxicity is kind of a whole nother package to unfold here. So there are some people that have allergies to mold, and they'll get stuffy nose or such. Some other maybe mild symptoms. There are some people where maybe their mold exposure is very, very severe, and they'll get very sick and could get a lung infection, a fungal lung infection, and they end up in the
Okay.
ICU. And those kind of situations are what mainstream doctors understand. Where they don't understand it is the person who has probably, in my opinion, some type of a detox problem, able to detox their body. They have an immune system that's out of whack. And then they are in a workplace or a home or school where there's mold. Not all mold is toxic, but certain mold varieties are. Um, and and then, of course, we're in homes now that are built tighter. The airflow is less. So we just don't have as clean air in our homes. And so even minor mold problems could be accentuated. And then what happens is you have a certain population that reacts and gets very sick from mold in a way that mainstream doctors aren't familiar with. So they might develop weird autoimmune symptoms, flu-like symptoms, headaches,
Yeah.
kind of more of those, what we talked about before, complex kind of multi-organ uh, system type symptoms. And then there's other people who can be in the same home and be perfectly fine, or have very mild, maybe more of the allergy type reaction.
Wow.
And so for me, I was in that first category where it made me sick, and it was it was an older home that had some water damage. And what I found with us, so once we identified that and we had it remediated, and we actually went through lots of testing to make sure it was, gone, and there weren't active mold spores, and that it was a safe environment. But what I found with my health is that And I think this is the case with many people who have the very bad, sick mold toxicity, is I developed almost what you would call like an autoimmune reaction to what the spores release, a secondary thing called a toxin. It's called a mold toxin or a mycotoxin.
Hmm.
And those are understood, not even in science, they're actually used for biochemical warfare and things like that. But
Okay, wow.
well, yeah, but of course, mold in your home probably for most people wouldn't release enough to cause any problems. But the mycotoxins for people that are very sensitive, so even when the mold's gone, the air has been cleaned, I formed what I believe was like an autoimmune reaction to like my body. This is super theoretical. I'm totally guessing on this, wondering, but I believe my body, when I was in that environment, the air combined with the mold toxins when they were there, that we eventually tested, and we believe that those were removed where there weren't risks for other people, but that weren't in it at the time when I was in it, when it was so, there were so many. But my body, I believe, reacted in a way that it formed to the compounded air connected to the toxin. It formed an immune response. So even in that air without the mold toxins there anymore, or very little amount, I just still didn't feel like it was a place for me. So we ended up selling the house. Once we of course had it safe for other people to be in, but for me, it was not safe.
Yeah. I mean,
And maybe not safe is the word. I think I could have lived there and I still would have felt better, but I wouldn't feel as good as I feel now.
yeah. Well, so you
Yeah.
developed like a heightened sensitivity to it. And you were saying like your husband would kind of just get what, like a runny nose, or like he had different symptoms.
He actually really didn't have any symptoms.
Oh, wow.
Yeah.
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 And see, that's one thing I wanted to point out here with the mold in your house is it's like you could have a cause to an illness that seems so confusing and contradictory. Like, well, no, it couldn't be mold because, I have a weird thing and this other person lives in the house and they don't experience any of that. And, I mean, you can have, or food allergies can be really confusing, or I don't know, there can be so many different things that are causing your particular chronic illness that just like adds to the complexity of the invisibility, that just makes it even like harder to find the cause. And it can be a
Right.
struggle
Right.
navigating and investigating all of that information.
Yep. Yeah, exactly. Because you're like, well, if we're not all sick, getting out of the mold, my husband noticed some minor things that maybe were better. His eyes weren't as dry, things like that. But no, he
Okay.
was fine. He felt fine. So it's very, very weird. But also, like you said, it's very confusing then for people problem solving
Yeah.
and trying to, work through things. So, and there's a whole, um, yeah, I mean, there's a whole belief system about mold avoidance. There's some people that avoid it very strictly. Um, and there are, different websites you can go to and Facebook groups. And that I monitor that and such. And I found that I don't have to be as strict for my health. But it is something where I do still need to avoid the very toxic mold,
Yeah.
or I don't feel good. Yeah.
Yeah, absolutely. Let's talk about hope. Let's talk about what you've been able to do that has made the changes in your life for the better, and what you feel like other people need to do to make better changes in their life with their chronic illness. I mean, for you, it was changing houses. It was understanding and navigating through all of your medical issues and trying to research those. And, when you were struggling, there were probably points where you were bedridden and maybe you were like in tears and it was sad and it was hard and you were struggling. And, what was like the hope that kind of got you through a lot of things? What's the hope that people need to be holding on to here to know that like, okay, things could get better. There could be better days. I'm not going to give up right now. I'm going to move forward. Here's my next steps. How do we hold on to that hope?
Yeah, no, that's a great question. So I think, for me, there was hope because I understood, with my background, I understood the body. And as I got further, I became more and more hopeful. I think the more you know and understand. So part of it is just learning about your body, and knowing that you have options out there. There
Hmm.
are people out there, you just have to search. And if you feel too sick to search, then you can work with someone like me who can search for you and find people to help you. But I do believe that's the hope, is that there are people out there that understand what you're going through,
Yeah.
and that they can help you and your body start, essentially you're peeling away the layers of the onion, because I believe illness it starts out maybe as one thing, but then the immune system and the adrenal glands and all these different organs start kind of going off kilter when the body's off. And the gut, the how your digestive system works, that's a big part of all this. And so getting to someone that can help, um, you always want to see a mainstream doctor to make sure there's not something obvious going on that they can catch. But if you feel that they're not helpful, then it's something to maybe consider, working with an integrative or functional doctor. So an MD is what I prefer, someone who's been through medical school, who understands that. And then you want to try to do research and make sure you're working with someone reputable. There are people out there, like any business, any specialty, who are doing stuff that's on the edge of what's, in my opinion, safe for
Hmm.
treatment, especially in these fields where there isn't regulation like there is in mainstream medicine. But it's at least worth looking into that, looking into maybe a nutritionist, or, you know, diet is huge. I mean, there's so many things that can um, help. So there's always hope. And then I think, um, looking for support. And if you're not finding that with friends and family, there are some Facebook groups. You can look up your symptoms even and look up support group or just group on Facebook. Or if you have a diagnosis, you can look up, for example, fibromyalgia group, and you can look at these groups. And then you have to kind of use your best judgment. Some groups might make you feel more negative because all
Right.
you hear are the negative stories, but others are going to have really helpful, thoughtful information and really helpful people. And so you have to kind of, it's a process, but always know that there's hope. There's always improvement. And you do, and also learn to appreciate, one thing that I had to do early on is, I had a friend of mine say, do you keep a gratitude journal? And I thought to her, I go, no. And then I thought to myself, that's a stupid idea.
Oh no.
And yeah. And the reason I thought that was because I thought, I don't have anything to be grateful for.
Oh
Like, I
yeah.
literally thought that, so what
Yeah.
am I going to be grateful for? That I was able to get out of bed to go to the bathroom, or I was able to make soup on the stove today, or, I was able to take a shower after 7 days of not being able to shower because I was too sick,
Right.
and when I showered, I had to sit in the, chair, a shower turn, all these things. But what I did is I decided, okay, this lady's a smart lady. I'm going to try it. So I started uh, every night before I went to bed thinking of 3 things I was grateful for. And even if they were
Mm.
silly to me or small, or I felt in the world of life, they were super small. Like, I was able to get dressed today. I still thought about them and was thankful for them. And it was interesting how my attitude changed and how I became more positive. And the more positive I became, the more hopeful I became. And the more hopeful I came, the more I was able to see my health kind of from an outside view and analyze it and start working through things. Um, so that made a big difference for me, was gratitude. And I know, like I said, it sounds stupid probably to other people, just like it did to me, but to me, it helped a lot.
Yeah, that's really powerful. Wow. And no, it's not stupid. I think that that totally makes sense when you can put things in perspective, when you can think positively like that, when you can be grateful for all the small things you have in life. That's totally going to change your attitude, your mindset, your emotions, and it's going to give you a whole new perspective that will give you hope. I think that's really simple and really
Yep.
powerful. And I mean, of
Yep.
course, the things you're talking about earlier, find an advocate, maybe try different doctors if there's different people in different realms of medicine who can help you. Make sure you have a strong community, Facebook groups, or people around you to support you. And I mean, like you were saying, you might be at a place where you're almost too sick to really like go out and meet the people you need. I mean, you might need
Yep.
somebody else who can be your advocate. Like for you, you were talking about how your husband was doing research for you. You know, like he was the person who was kind of standing in the gap for you, trying to fix all those things that maybe you didn't have the energy or the motivation to quite do for you. So that could be really, really powerful.
Yep. And I was lucky to have that. Being sick can be really hard on marriages. And so that's a whole nother topic. But there's hope there still with all of that. And there's people out there that can help. You know, one of the things I think, you know, there are churches out there that no matter what your religion is, or even if you're not religious, are still willing to help provide services to people in need, no matter where you're at, you know, spiritually or religiously. So that's one option. There are organizations out there. And, you know, I just feel like there's always something. And so just don't give up hope. You know, I think that's the biggest thing. There's always something, no matter how sick you feel, there are options out there for you. I just want people to know that, you know.
No, you're right. There's a lot of good church organizations. There's a lot of other just support organizations out there.
Yeah.
There's a ton of different resources that people can find. And I think that it's just a matter of looking and knowing about those and getting connected to those communities. That can make a world of difference for people when they have those support groups, other people they can talk to, you know, like yourself. If you can talk to somebody who has been through that experience and they can tell you what they did and share that, then that makes so much of, you know, emotional support and just understanding of the how-tos and all that stuff can be huge. Just somebody who believes you and like can provide hope, right?
Yeah, exactly. Yeah, just having validation, you know. Yeah. That's huge.
Yeah, 100%. And that's why we're here recording on this podcast, because we're sharing experiences, you know, we're telling people what's going on. So yeah, that inspires me. That's really helpful. Well, Amy, thanks for being on today. I really appreciate your insights. It's been awesome. You've got things that are, you know, inspiring me and making me more grateful for what's happening in my life and things that I'm doing with people. So I really appreciate just you sharing your story and giving people the advice that you've given today.
Well, I thank you. I really appreciate being able to, you know, be a part of this, and I love what you're doing and keep doing it. So I really appreciate it. Thank you so much.
Thanks for listening to this episode with Amy. If you want to be involved with the podcast, there are 2 ways for you to do that. First, if you have any questions you want answered or topics you want us to talk about, then click on the BEET Pain website link in the show notes and message me. Second, if you want to continue listening to great content and guests, then I need your help to build the podcast and get those guests' attention. The bigger the podcast gets, the easier it is for me to bring on more guests. Subscribing, writing a review, and sharing this with others helps this show to grow. Thanks so much for listening.